Oh.
Cute dog. Oh, now you're on Facebook, Amber. You're good on Facebook now.
Awesome. Okay, so I think that means we're ready to start. If anybody joins us a little late, I'll just pay attention to the waiting room and make sure I let them in. I think most of you probably know our awesome speaker today, Cheri Prince from PDWELL. She's going to be joining us to talk about how to prepare for a hospital stay during COVID. So something really important for these times. I know that I've heard some experiences from people in the community, not great ones for not being prepared with just everything going on. So I'm really grateful to invite Cheri here to kind of give us a little lowdown on how we can be more prepared. Cheri, are you able to share your screen?
I am, yes. So I'm going to go ahead and do that. All right. Can everybody see that?
Yep, looks
okay.
good.
Good. All right. Well, thank you, Amber. As Amber mentioned, my name's Cheri Prince. I'm a physical therapist and from PDWELL, which is a Parkinson's Therapy and Wellness Resource Center here in Omaha. But my role tonight is talking to you as an Aware and Care ambassador. And what that is talking about preparedness for hospitalizations or any inpatient stay, any stay when you're away from home and maybe not in control of your own medications, those kind of things, or whenever you're ill and needing additional help. And so that is actually, this program is actually put out by the Parkinson's Foundation. It's actual kit. We're going to go through it tonight. And so I actually volunteer with them to talk about this program. I think it's really important. It's very important to me that to get the word out to folks to be prepared when they go to hospitalization. So we're going to go through a little slideshow that talks about the risk of hospitalization when you have Parkinson's, some of the things that can go wrong, some of the things that we want to be prepared to prevent from happening. And then besides just regular hospitalization, we also now, as Amber mentioned, have this COVID situation, which has made things even more complicated for persons with Parkinson's when they're hospitalized, because our ability to have caregivers or family members with us is either sometimes totally not allowed or off limits. It seems like it really depends on where you're at now as things start to kind of open back up. Some places are allowing it, some aren't. So it's even kind of more confusing. So we're going to talk about all of that. So, okay, I'm going to see if I can get my slide to go forward, which there we go. Okay, sorry. Well, I kind of probably already talked about a lot of this, but why are we discussing it? I want you to understand the risks associated with hospital stays, and there are quite a few. Show you the tools that are available through the Parkinson's Foundation to play an active role in your care, be prepared for a hospital visit, whether it's planned or unplanned. And that's why we talk about this now, is because many hospital visits are not planned. And so it's good to be prepared because you never know when you might need a hospital stay. And then how to develop strategies to get the best possible care when you're in the hospital. So obviously the goal is to be aware in your care. So this just is, the next few slides are a few statistics about hospitalizations, and these statistics actually are kind of pre-COVID. I don't think we have a lot of information yet specific about the COVID effect on people with Parkinson's and hospitalization. So this is even actually prior to COVID. So usually when somebody goes home, sometimes we talk about the transition from hospital home being very challenging. For people with Parkinson's, it's actually the reverse, or I would even argue it's actually both. So it's both, there's more increased hospitalizations with people with Parkinson's, and also when we're going home or discharging back out of the hospital, possibly to another inpatient setting, there's certainly a lot of complications. So 1 in 5 Medicare beneficiaries, so this isn't just Parkinson's patients, but 1 in 5 Medicare beneficiaries discharged from the hospital is readmitted back to the hospital within 30 days. So I think we all have an underlying belief system that hospitals are safe, right? That and these are some of the things that we have to really talk about in order to understand and be prepared for hospitalization if we have Parkinson's disease. We have to understand what our underlying beliefs are, what really the honest reality is in a lot of situations, and then therefore what we need to do to deal with that. So many of us have underlying beliefs that when we go to the hospital as a person with Parkinson's, they will call your neurologist. We feel like every pharmacy will have Parkinson's meds or the ones that you're on. Most people believe that any medical staff would certainly understand Parkinson's symptoms. Also, that nursing staff will bring your meds on time, and that they know there are certain drugs that can be dangerous when given to a person with Parkinson's. So those are kind of all underlying beliefs that most people probably have kind of going into a hospital stay. Here's a few more statistics. So Parkinson's and hospitalization. So 1 in 3, this is all specific to Parkinson's patients. So 1 in 3 people with Parkinson's that go to the hospital are then admitted. So if you're just rounding numbers, or you're talking about 100 people with Parkinson's that go to the hospital for some reason, 33 of those will be admitted to the hospital. Then 3 out of 4 of those, so 75% of the persons with Parkinson's that are admitted to the hospital, that's a lot, 75%, 3 out of 4, will have their medications changed in some way. And that one is really staggering to me because, I mean, certainly I would believe, I think a lot of people believe that when you go to the hospital and you tell them you're on this med and this med and this med, that they will continue to give you this med and this med and this med. But unfortunately, the reality is it is not true. Many medications are changed. I just have been living this exact experience with my aunt who lives with Parkinson's. She lives in rural Nebraska in a facility. And when she went into the hospital, they compared, the pharmacy at the hospital looked at her list from the nursing facility that sent her there, and they compared it to their formulary that was in their pharmacy, and the things that weren't on their formulary, they just discharged off her medication list, and she did not receive those medications. And so that included an antidepressant, that included one of her Parkinson's medications. And so she was definitely in this 75% of people that medications were changed. And then out of that 75%, 2 out of 3 people will experience complications. So that's a lot of people out of the 33 that were originally admitted experiencing complications from their hospital stay due to some sort of medication change or error. Reality is people with Parkinson's are hospitalized 44% more than their peers without Parkinson's. People with Parkinson's suffer avoidable complications at a much higher rate than non-Parkinson's patients. And most of the biggest outcome for that is that most people with Parkinson's have a longer hospital stay than their non-Parkinson's age similar counterparts. So why does this happen? There's a lot of reasons. In fact, again, this is also fresh to me right now because I've been going through it with my aunt, and my cousins and my uncle have been calling me and asking me, like, why would this happen? I don't understand why they wouldn't just give her the medications on the list. So even at the best hospitals, there can be a lack of understanding of Parkinson's disease. Non-Parkinson's specialists, so non-neurologists, non-movement disorder specialists, are frequently not fully aware of the critical importance of Parkinson's medication timing. So important, and that is a huge factor that's missed. I probably talked to 20 different nurses during my aunt's hospital stay, and really none of them had any awareness of how important it was. So if they walked into the room and she was kind of a little sleepy, they just held her medications. And so when I would just be calling to see how she's doing, they're like, oh, she's doing okay today, but I went just to take her Cinnamon and she was asleep, so I'll go back later. And so it was a constant. I had to say, no, actually you need to go back in there now and wake her up and give her her medications because she needs them. So the critical importance of medication timing is definitely not common knowledge among medical staff. Hospital pharmacies do not stock all Parkinson's medications. And hospital staff may not know that many common medications can be unsafe for people with Parkinson's. And we're going to get to that. There's a whole section in the kit about what medications a person with Parkinson's should not receive. So only 25% of hospitals have a mechanism in place to contact a person's Parkinson's doctor upon admission. So most facilities, most hospitals do not have any contact with a person's neurologist or movement disorder specialist when they're admitted, even though they have a diagnosis of Parkinson's. And for people with Parkinson's that are in close contact to their neurologist or movement disorder specialist, that seems kind of unreal. Like, why wouldn't you contact them? But the truth is, it doesn't happen. And I would say, again, these slides are made by Parkinson's Foundation, but my personal experience is actually also that not only is that an issue, but frequently in hospitals now, you're not even necessarily, your care is not even being directed by your primary care physician that knows that you have Parkinson's. So many times a hospitalist is taking over people's care that are admitted as inpatients, and they may not even be aware or have any background in how important your Parkinson's medications are. So there's a real lack of awareness. The next stat is probably, when I did this training, was probably the one that was the most shocking to me. So 70% of hospital staff, and when you actually go into this study that they list right there, it's actually not just hospital staff. So when they're not lumping like everybody that works in a hospital that's non-medical. This is actually medical staff, so CNAs, med aides, nurses, doctors. 70% of hospital staff are unaware of the drugs that worsen Parkinson's symptoms or are contraindicated for people with Parkinson's. So when you look at that, 70%, that is a huge amount. The room for error is very, very large, and it can be very scary. So again, we kind of talked about these lack of awareness of the critical importance of medication timing, that common medications for pain, nausea, depression, and psychosis are unsafe for people with Parkinson's. So this one's really important because most people that go to the hospital have pain, right? We go to the hospital because something's wrong with us, and we typically have something happening that's causing us pain. So we're frequently getting pain medications when we go to the hospital. So we need to have an awareness of which ones are safe. Same with nausea. If we're in the hospital for a surgery or anything, many people are post-procedure nauseous, right? And so we have to know which medications. Depression, psychosis, those medications, some of those medications, frequently when our Parkinson's medications are withheld, we end up having more complications that can lead to some behaviors that then are treated by medications that are even more dangerous for the person with Parkinson's. So it's this vicious, domino effect of negative things that can happen. And there's a very strong lack of awareness that poorly managed Parkinson's might result in mental confusion and other serious symptoms. Like, again, going back to the example of my aunt, that the nursing and actually even the hospitalists had absolutely no idea that if someone did not get their Sinemet consistently, that they would end up being more sleepy, not able to swallow. My aunt, again, started not being able to swallow, and they just really didn't understand that you're not going to be able to swallow unless you get your Parkinson's meds to be able to keep you being able to swallow. And so if you haven't given meds on time, you're going to have difficulty swallowing them when you do give them. So just that understanding that when you don't manage Parkinson's well, you can have a lot of serious complications. So hospitals are very complicated. You have all of these different people that are interacting with the person with Parkinson's. So physicians and surgeons, therapists, social workers, dietitians, pharmacists, nurses. And not only that, but within this realm, you can have many, many people, right? So my aunt actually was in the hospital for COVID. And even though she was in what I would say, a restricted unit, every day I talked to different staff that was treating her. So even though nurses are only one person on this wheel, you could have 20 different nurses that you're interacting with within a few days. Same with physicians, many different physicians interacting in your care. And so it's really hard to kind of keep up with all the people that could be making decisions that then have an impact on what's happening in your care. This one just kind of talks about all the different ways. First, the other slide was kind of all the different people that can interact and And if there's one slight tweak of something by any one of those, you can have a negative effect. This kind of talks about all the people involved at each step of admission. So if you have an emergency admission, you have first responders potentially bringing you to the hospital. You have ER nurses and ER physicians that are then admitting you to the hospital. And frequently, this is where the first problem lies, because many ER physicians and nurses are very trained, pretty much used to, if they find something wrong, let's say you fell at home and broke your hip and you go to the hospital. Frequently, they'll do the x-rays, whatever, and then they decide to admit you. And frequently, right then, they will go ahead and decide that you're NPO, or nothing by mouth, because they would anticipate that once ortho comes in and sees you and wants to do a surgery, they don't want there to be anything in your stomach. So right at the ER level, you can start to have problems of understanding where your Parkinson's meds need to fit into this. And then even planned admissions, you can have the Parkinson's patient's doctor, if it's just like I mentioned before, the internist or the hospitalist taking care of your care, and then unit nurses. So there can be lots of places where errors can occur. Again, seemingly minor errors by any of these people can mean a crisis. And frequently, again, the timing of medications is really hard for people to understand. So in the hospital, orders frequently are written like BID, like twice a day, or QID, 4 times a day. And so when those orders are written like that, then that gives nurses leeway to when those medications can be given, because they just have to be given 3 times a day, or 4 times a day, or 2 times a day. And so they can be setting up a totally different schedule. So let's say you get your medication 3 times a day. Okay, so the nurse puts you on a certain schedule, 6, 12, and 6. Let's just say these are just examples. But at home, you take your medications at different times. So your body, as a Parkinson's person, needs to continue to get the medications in the way that we're working for you at home. So even just that difference of, even though you're getting it the same amount of times per day, because they ordered it 4 times a day or 3 times a day, if it's not the same times, that can be a big issue. Okay, so challenges for Parkinson's care. We've talked some about these, but frequently your Parkinson's is not the primary reason for being admitted to the hospital. And that's exactly what happened in my aunt's case. My aunt had COVID, was positive for COVID, actually didn't have very many COVID symptoms, but went into the hospital. That hospitalist was working on a hallway or in a wing that was all COVID. Was seeing some people decline because of COVID, kind of automatically assumed that my aunt's decline was due to COVID, and didn't really factor in any of the Parkinson's. And so frequently the physicians and the nurses' focus will not be your Parkinson's, because you're there for something else. And so you have to really watch that, because then you can start to have a lot of complications from people not paying enough attention to your Parkinson's because you're there for a different reason. Providers definitely lack necessary Parkinson's experience. Remember, most general hospitalists or internists see every diagnosis in the book, so they're not going to be experts in Parkinson's. That's just the reality. Parkinson's medication regimens are complex. We've talked about this many times for anybody that's in any of my groups. And so they are, every person, what do I always say? And I think I got it even from somewhere else, but if you've seen one person with Parkinson's, you've seen one person with Parkinson's, right? Everybody's medication regimen is very different. And so that does not fit well in the hospital setting. It's not really anyone's fault. It's just, that's the reality. And so we have to put other measures in place to make sure you stay safe. And then Parkinson's patients often have complex mobility issues. And what does that mean? That means sometimes people with Parkinson's have falls and look unsteady when they stand, or have functional differences throughout their day based on when their medications are given. And so all of those things are red flags in hospitals, because hospitals do not like to have falls. And so, and same for skilled nursing facilities. So most of the time, if you're in the hospital or you're in a skilled nursing facility and you've had a history of falls, they are going to what? Not want you to get up. They want you to stay in your chair, and they're going to put an alarm on you, and they're going to tell you sit down. They're going to tell you not to get up, because they don't want you to fall. So it's not out of negative, they don't have negative intentions, but what that causes for people, a person with Parkinson's can have a very negative effect. Again, we've talked about a lot of these. So multiple medications are used to treat Parkinson's. We know that very few people are on the same regimen. Contraindicated medications are often not recognized as such. We talked about this. Changes in timing and dosing of medications affect patient status, and compromised swallowing ability may dictate a change in medication formulation. And this actually did happen with my aunt as well. She got to where she could not swallow because she hadn't had so many doses, I mean, days and days of her Parkinson's medication. And so we had to fight to get her dissolvable. There is a dissolvable form of Parkinson's meds or Cinnamate. And so, but of course that wasn't in their formulary. I mean, it was just this vicious cycle of how are we going to get this taken care of? And it took me 6 days to get dissolvable Parkinson's Cinnamate, dissolvable Cinnamate for my aunt in the hospital. So, and that's a reality. This just happened. This is not like a story from 10 years ago. This is a month ago. So anyway, it's very real. Okay, mobility challenges. I started talking about this, but we need, for Parkinson's folks, we need to make sure you mobilize early. We need to make sure staff understands that that's important. We need to understand, staff members and care staff need to understand that functional abilities vary throughout the day based on when your medications are given. And also, you are probably at high risk of falls, but there's also really high risks of lack of movement as well. So we need to make sure we get mobility kind of high on the list of a priority. So the role of the patient and the care partner, and again, this is where COVID really comes in, that this care partner situation has been so limited because of COVID. And so I would tell you that now being prepared and going in ahead of time and really knowing how to advocate for yourself is even more important under COVID. But each person with Parkinson's and or their caregiver has the best knowledge of their disease and conditions. Each person with Parkinson's has a unique combination of medications. We talked about that. Each person with Parkinson's is most knowledgeable about their own special needs, but might have trouble communicating that. So again, my aunt, who is very 100% cognitively intact and can tell you everything about her medications, was 100% not alert, not able to speak, not able to tell them. And honestly, the staff at the hospital assumed she was confused and demented because she came from a nursing home. And they did not think she was even verbal until I told them on the phone, like, why is she not speaking? She's verbal. Like, that's how we kind of peeled back that she wasn't getting her medications. And care partners can have all of the above information and need to be able to advocate for the Parkinson's patient. So this comes in the Aware and Care Kit. So changing the outcomes, that's our goal, right? We want to change the outcomes so these negative outcomes do not happen. So the goal is to get the right medications on time, every time. So in this kit, I'm going to kind of just hold it up. This is a kit. It's a little bag. It's like a little fanny pack, only it doesn't have a waistband holder, but that's what it looks like. We're going to go into how you get one and what's inside, but inside, one of the things that's inside is this magnet, and that's what's shown on your screen, this little magnet. And it is a magnet to remind staff that you need your Parkinson's medications, like the ones that are ordered for you, not the ones that is on their formulary, the ones that are ordered for you on time, every time. And so this magnet is designed to go either, a lot of hospital rooms now have those dry erase board where the nurses write their names and the date and when you had your last Tylenol and all of that stuff, or even on like the frame of the bed, kind of right by your head if you have a metal bed. So just anywhere where a nurse is going to see it every time they come in the room. And no contraindicated medications, never Haldol. And that's printed on there as well, as a way to remind staff. Anti-Parkinson's medications are as necessary to a Parkinson's patient as insulin is to a diabetic. And I think that's the difference, is there's no one that would go into the hospital and not receive their insulin. That wouldn't happen, but we are not there yet with Parkinson's. And so we need to get there. So actually the acute discontinuation of Parkinson's medications actually can be life-threatening. It can, there's some rare things that can happen when you just eliminate Parkinson's medications. I would say that part, the life-threatening piece of that acute condition that can happen because of it is more rare, but certainly there's a lot of negative outcomes that can happen. So the idea is that Parkinson's Foundation wants everyone to have an Aware and Care kit to help you be better informed, to help informed. So they really, actually the Aware and Care program is designed for education for the Parkinson's community, like an event like tonight, but also, and that would obviously include the care partner as well, but also healthcare providers and hospital facility staff. So that's why we have these Aware and Care ambassadors like myself that are working multiple angles to try and get the word out. So I do these community talks, but then also I've been working with the hospitals to try and get their programming, get into their programming and their nurse education so people can hear about that. And then also healthcare providers, so trying to get in front of nursing students and therapy students and everybody you can to get the word out about the risks of hospitalization. Okay, so now that you've heard me yammer on for about, I don't know how long, probably longer than you'd like already, I asked Patty Jackson, who's on tonight, to talk. She has been through this. This slide was designed for me to tell you some stories from Parkinson's Foundation about the Aware and Care kit and the impact, but I thought it would be much better if you heard from somebody that was already on the call. And Patty was willing to share her story about Paul, her husband, and a recent hospitalization. So Patty, thank you so much for being willing to share your story, and we're looking forward to hearing it.
No problem. So yeah, Cheri's right. We went through the Aware and Care training. We've been through it twice, actually. And recently in June, Paul was hospitalized for a knee replacement. And so I went into the hospital thinking, I was pretty confident. We made sure that the movement disorder doctor knew that he was having a knee replacement. They coached us on what drugs to stop taking and what kind of anesthesia to suggest to go with the spinal rather than general anesthesia. And you know, just gave us coaching ideas on what to do. And so we went to the hospital, just like Cheri said, immediately when he got out of surgery, he was already an hour late for his meds. So he was already an hour late for his meds. I immediately started asking the nurses about his medication. Oh yeah, we've already ordered it from the pharmacy, and they come in and check like every 15, 20 minutes, check vitals. I'd ask the next nurse, yeah, we've ordered it from the pharmacy. It hasn't arrived yet. Well, finally, I just got fed up and I took the medication out of my purse and gave it to him. Had the bottles with me. And the next time the nurse came in, I told her that I had given him the medication and here's what I gave him, and told her the time that I gave it to him. So she wasn't very happy. And I think it made some more documentation for her is basically what happened, but at least Paul got his meds. So I was feeling pretty good about that. From the hospitalization, you know, I'm like, yay, Patty, we did good. From there, we went to the skilled nursing facility where everything kind of changed. At the hospital, I was able to stay with them for the 3 days of hospitalization, so I could kind of see what was going on. And there was a time when he was starting to have some hallucinations, and so I suggested, let's not give him pain meds if he's okay with that, and he was. And so we went with Tylenol. So I was feeling really good at the hospital. But when we got to the skilled facility, everything kind of changed. I wasn't able to visit, so I had to visit him through the window. So it was really difficult to communicate. We had to use our cell phones and look through the windows. Depending on the sun, you might be able to see each other, you might not be able to see each other. He was getting phone calls from the facility. He was having several falls. He wasn't sleeping very well at all. So I got on the phone, actually I got on to one chart and again contacted the my neurologist friends and said, hey, this is going on. Do you have any suggestions? And they came back with a suggestion of Seroquel. And so I mentioned that to the facility and that they were actually not as concerned about the hallucinations as they were the lack of sleep, because 2 or 3 hours of sleep is not enough for somebody in a night. And so I suggested the Seroquel, told them that they had suggested the Seroquel. They're like, oh, okay, great. Well, next day I get another call, he had fallen again, or he was walking the hallways, or just calling me to tell me things. And I'd mentioned Seroquel again. And so finally, I believe it was like 6 days later, their doctor finally, or the internist, or I don't know what she was, the person in charge finally prescribed the Seroquel for him. But by this time, he was pretty confused and actually did become a little combative at one time. And I got a phone call at like 5 in the morning, and the nurse said, hey, your husband has become pretty combative, but I gave him some Haldol and he's nice and calm now, actually. But if you want to talk to him, that would be great. And I don't have these drugs memorized either. And I guess I understand that nurses don't know everything, but yeah, that was a pretty big one. So it woke me wide awake. And I'm like, you cannot give him Haldol. And I was pretty upset about it and told her she needed to write it in his chart, highlight it. And so I got on one chart again, let my neurologist friends know, hey, this happened. Is there anything that you can suggest now? And so the confusion continued. He was definitely not given any more Haldol, but that was pretty clear not to have that. Confusion continued, and he did eventually end up back in the hospital a couple days later, and just got his medications totally switched around, and happy to report he's doing great now. But yeah, he was between the hospital and the care facility, it was 50 days of just a total nightmare. 3 of those were hospital, the rest was in the skilled facility. So like I said, I've been through the Aware and Care training twice, and feeling pretty good about it in the hospital. Like, yay, we did good. I, was able to ward off some problems. But when it came to the skilled facility and you, as a care partner, you're not there seeing what's going on. You can only, talk to them through the screen. You can suggest to nurses, but you can't really, be forceful, I guess. Bad things happen. And I don't know, I'm just thankful I had the training. So when she called and said I gave him Haldol, she was feeling pretty good about herself, thinking, hey, he calmed down right away and now he slept for 2 days. This is great. And I'm convinced when he became really, really confused later on, they probably would have given it to him again or turned it into a regular routine, daily, given it to him. I'm almost positive it would have been, because she had no idea about the Haldol. So anyway, that's the story.
Thank you, Patty. I think that is, thank God it has had a positive outcome now. But your story is perfect example of somebody that was prepared, but still, there's just so many levels of things that can happen, and skilled is a whole nother level beyond even the hospital. That's why when I opened this up, I said, I think even skilled is almost even more important than the hospital sometimes, because you're typically there for longer. And the chances of that staff having knowledge, even as much knowledge as the hospital staff, is even it's less likely that they have training. But then your story really brings in the fact of COVID, in that Paul has a great advocate and care partner in you. But yet you couldn't be there. And I think that your story also really shows what COVID can do as far as the isolation. He couldn't be as mobile because he was on quarantine for those 14 days. So he was kind of stuck in his room. He couldn't even go to the therapy gym. So yes, they were doing some therapy with him, but he wasn't as mobile as he could have or would have been. Also, when you're having hallucinations or you're having any confusion, how scary it is when you have people that are masked up, when you're looking through a window and talking on a phone instead of seeing Patty, who obviously Paul's used to seeing throughout the whole day, what that can do. And then if you have the staff that's not aware of what that can do and then give the wrong medication, it can just really be a nightmare. But I'm so grateful that you got back to the med center and got everything fixed. And thank you for sharing your story. Haldol, by the way, the reason Haldol is so bad is because Haldol works on dopamine receptors. So basically it blocks all the levodopa. So he can still be getting his Parkinson's medication, but the Haldol basically goes on to where the dopamine would connect, and the Haldol becomes a block to the dopamine receptor. So you're basically getting very limited amount of your medication, even if you're continuing to get your Parkinson's medications. So that's why you can basically become unable to move. And I can't remember, Patty, one of the times I talked to you, you used a word of something like he was basically frozen, or that wasn't the word you used, but basically he couldn't move. He was max assist for transfers, and functionally he had super declined after the Haldol.
Oh, it sounds so much like your aunt. I'm not kidding.
Yeah.
The conversations I had with the nurses,
Mm.
and they talked to me. I mean, they thought he was an invalid. I mean, they honestly, they couldn't believe that he used to walk and was able to communicate, and they could not believe it. And I couldn't believe what they were telling me, because the person they were describing was not my husband at all.
Right. Yeah. It can be so scary too. Yeah, Barry, you're on mute though.
I have experiences similar to theirs. The first thing was I went to the ER room, and I was amazed how smart these people were, but didn't know what the pump was that was hanging on me, even though I told them. Then somebody got the bright idea that if we shut the pump off, that would go ahead and make it work better. And I said, no, it won't. I will become combative, because I will start going ahead losing control. When they brought the cartridge up for the next day, my wife brought it up that night. The pharmacy had to have it. It could not stay in my room. So the pharmacy had to have it. And they asked for the pump too. And I refused to give them the pump. I said, you can pry it off me. You're not getting it. And she said, well, she said, you're not going to understand. You're not going to get your medicines until the pharmacy brings them up. I said, well, they can bring them up on time. Or I said, I'll fall down to the pharmacy and get them.
Right.
And you have to sometimes be a little blunt with these people, because they don't understand, what happens. I mean, they're telling you that you can take your meds whenever you want, but then they don't understand why you're falling, trying to go to the bathroom or something. Well, I did not have my meds.
Right.
I've taken this to the hospital 3 times. Yeah. And it works very good. Are you advocating, Cheri, that we take a couple days pills with us?
Yeah, so we're going to talk about the kit. Yeah, we do advocate for that, yes. However, you may not be able to use them in the hospital. They may confiscate them. And same with skilled, but we do advocate that, yes, you put your meds in the kit. So we're going to go, I think the kit, what's in the kit and what we're going to do with the kit is next. So
okay.
Thank you again, Patty. Now I just have to find my slideshow again and share. Okay, can we see it again now? Yeah. Let's see here. Oh dear. Hold on 1 second. There we go. Okay. Okay. So what's in the kit? yeah, that's exactly what's next. So, okay. So this kit comes in this little bag, and the bag is designed, the reason it's kind of this size is I think they've kind of tried to make it as much as a travel bag, so you don't have to take something extra. So besides going to the hospital for planned admissions, we actually recommend that you travel with this, so you take this with you. So I think they've kind of made it a bit like a bathroom bag as well, so you can put your medications in it or other things that are essential to your care, and just pack it right in your stuff, just like you would your bathroom bag. So like pack it in your carry-on and take it with you if you're traveling, that kind of thing. So that's why it's kind of a little bit of a bigger bag. And then these are the things that are what's in it. So we're going to go through each one, and then I'll tell you a little bit more about each one. So that magnet that we talked about, there is a Parkinson's disease alert bracelet on there. That the purpose of that really is to try and direct people, well, first of all, to tell them that you have Parkinson's, but really to direct them to this wallet card. So there's a wallet card in here as well. And it does have a lot of information on it, and it is in tiny print. So because they put a lot of good stuff on there, but it is tiny. But basically it tells you that, it tells the reader in the card. So this would direct someone that if you go to the hospital unplanned, like you're in an accident, something like that, this would tell them you have Parkinson's, and it says right on there, see my wallet card, which would then lead them to this. And this has your basic information on it, as well as your emergency contact, who your physician is, and any allergies you have or medical conditions. I would highly suggest you put that you have an allergy to Haldol. I think that's the easiest way to probably get it through the system, that you can't have that. And I mean, it's not like they're going to go double check or something. I mean, you can just say you're allergic to it. That's fine. It does give, it says I have Parkinson's disease, which could make me move slowly and have difficulty standing or speaking. So it gives some basic information. It talks about how it's important that you get your medication on time, every time. It talks about do not stop my carbidopa-levodopa. It talks about that on here. So if they get this, it talks about which medications they should not get in the case of pain, nausea, anesthesia, antidepressants, or antipsychotics. Talks about MRIs because of DBS. Many people have DBS. And it talks about EKGs and EEGs. So that is designed to fold. It's unfolded in the kit when you get it so that you can write on it, but it's designed to go in your wallet. So the bracelet tips them off to the wallet card. Then the other things that are in the kit, probably the biggest thing to pay attention to, because you won't remember everything I said tonight, is this hospital action plan. And it's actually a book that walks you through all the information that I'm giving you tonight, and probably more, but really talks to you about how to plan for how to plan for an unplanned hospitalization, if that makes sense, how to be prepared for an unplanned hospitalization, and how to prepare for a planned one. So if you do have a planned one, who you can contact. And I know, like in Patty's situation, and you correct me if I'm wrong, Patty, but you originally did not think you would be going to skilled. So that really wasn't even an issue. You thought you would be going home and be able to continue to advocate for care. But this would give you an idea that if you have a planned skilled stay, so you know you're going to the hospital, the doctor has already told you you'll likely need skilled rehab afterwards. I would carry out all of the things it says to do about going to the hospital to the skilled facility before you go. And again, you don't always have the luxury of a planned stay, but if you do. So that's the hospital action plan. So I recommend you read through that when you get this. It has checklists in here of what you should do and all of those things. Basically, it goes through emergency, unplanned, and planned. The other things in here are medication forms. So these forms, it's really hard to see on here, but there you can kind of see them in the background on here. Basically, it has your emergency contact information as well. It talks about other medical conditions you have. It does have room for a medication list. There are multiple copies in here. Now, Most people don't want to sit down and fill these out. So what I have recommended to people before is usually when you leave the neurologist at the end of your visit, you get kind of a summary of your visit and has all your medications listed. So I would go and make copies of that and put those copies in there with these forms. I mean, you certainly can write them all out, but the idea is having multiple ones ready so that you can give them to multiple people if needed. And then there's special considerations on the back. So what I would do is fill out your contact information on here. I would just fold this with your medication list, but I would still fill out the back. The back talks about whether or not you have a deep brain stimulator or a duopa pump like Barry does, and what Barry was talking about staff not knowing about how to take care or what was even involved in a duopa pump. Talks about trouble swallowing and notes. So if you're having trouble swallowing, maybe you need the dissolvable formulation of Cinnamate, special dietary needs. Talks on here if you have balance issues, or if you get dizzy or feel faint, because orthostatic hypotension can be very common in Parkinson's disease. And so you can get that dizziness and faint feeling upon standing. So it would be good to tell them that. If you have Parkinson's disease related dementia, so that they know what your baseline is. If you have hallucinations or delusions sometimes as part of your Parkinson's, that's important for them to know, because sometimes hospitals will do that if they think you, or skilled facilities, like I said, if you're having some hallucinations, delusions, you get to be what they consider combative, they will frequently go right to Haldol. So it's good for them to know what your baseline is. So that's these forms. And again, when you get your kit, if you have one, or if you're going to order one after tonight, or I have them in stock and I'll tell you about that. You don't need to fill them all out, but I would recommend that you get some ready. And then the other thing that's in here is a pad. It's a notepad of this fact sheet for nurses. And it is a 2-pager. It is all the information, a lot of the information we've talked about, what medications they need to avoid, what are the symptoms of Parkinson's disease, what are the typical medications, what are the consequences of untimely medication administration. Talks about a little bit about DBS and duopa pump. It's a pad of paper because they want you to give one to every nurse. So your morning shift person comes in. Good morning. This is what I'd like you to know about Parkinson's disease because I have Parkinson's disease. Your afternoon nurse comes in. Good afternoon. This is what I'd like you to know about Parkinson's disease because I have Parkinson's disease. Okay, so that's why they give you so many. All of these parts to the kit can be reordered without ordering a whole kit. So, and that can all be done online or through me. So if you have a hospitalization and you go through all of the fact sheets, we'll just get you more fact sheets for the next time that you might need it, or same with the medication forms. The other 2 things that are in here that are important, or you may not need, but there is a informational sheet about deep brain stimulation and one about duopa. If you don't have either of those, you can probably just get rid of those for now and not even have them in your kit to not throw anybody off if they happen to look through your kit. But if you do have them, you should give those to them as well so that they have information about, because the duopa one, like Barry was saying, it talks about the cassette, it talks about the timing of it, it talks about the pump, it talks about extra doses, all of those things are on here. And so it also, what I also like about all of their forms is it does give a number for the Parkinson's Foundation. So it really does kind of back you up like, hey, I'm not just saying this, but the Parkinson's Foundation is saying this, and you can call their helpline at this number if you don't believe me, that kind of thing. So, okay. So it does have a lot of those supportive numbers on there as well. Oh, I probably just went all through all of these. So this is really what's each of the things that are in the kit. I just left the picture up during all of these things. So this is what's in the kit. We already talked about that. Again, you can also, that's one thing I forgot to mention. There is a Parkinson.org/med form. So you can go on the Parkinson's Foundation website if you prefer, if you want to still use their med form, but you want to type in your medications instead of writing them on that sheet, or maybe you don't want to use your medication form from the doctor's office. So there is a place where you can go type it in and print off as many as you want, which I think is kind of nice because some people prefer typing. A lot of people prefer typing over writing. Okay, so when should you use the kit? You should use it for a planned or emergency hospital stay. I have already said that. I would also add to this, if I were anyone else, a skilled rehab stay. So any inpatient stay, I would use it. Bring it with you. Pack and bring the kit when you go to the hospital. Ask a family member to bring your kit to the ER if you aren't able to take it with you at the time. Why does it say annual checkup with your Parkinson's doctor? So I highly recommend you take it to your doctor's appointment or deal with it at least right away when you come back. Now, if you see a movement disorder specialist, they probably are aware of the wear and care kit, certainly the ones at Nebraska Medicine. So it's not probably as important that you actually take it with you. But if you see a neurologist or a primary physician, I would definitely take it with you so that we can start spreading this awareness of the need for this education, so that your primary doctor or your neurologist can advocate for you as well when you're in the hospital. So let them know that you are aware of these problems and you want them to be aware of them, and you don't want anything negative to happen to you if you go to the hospital. So the other thing I like to talk about is connecting, updating your kit with your checkup to the Parkinson's doctor, because we know our medications get changed, right? So I don't want you just to get this kit after tonight and then fill it out and then put it on the shelf and never pay attention to it again. I want you to update this kit every time you go to the doctor. So if there's a medication change, so just get in the habit, you get home, you have the new medication list from your doctor, you make copies. You can even ask the nurse at the appointment, say, hey, can I get like 3 copies of my medication list or 5 copies of my medication list? I don't think any of the nurses would say, no, you can't have more copies of your medication list. Just tell them, I'm getting my aware and care kit updated. I need to be prepared and I'd like 5 copies. Traveling. So we talked about that, taking your medications in original bottles, keep the original label with the name of the drug with your doctor's name. So again, this would be like if you get a refill, save that bottle. At least it would have the original name of the drug and the dosage with you, and keep those in there instead of like mixing all your medications into one bottle, if that makes sense, or as a block baggie or whatever else. Keep them in there with the name and the dosage on there and your doctor's name, because you never know when you're having a medical emergency, you may not be able to remember your neurologist's name, right? That's why we have it all written down in the kit. So you don't have to remember it, because you might be having some sort of medical emergency where you can't remember it, and you may not have a care partner with you either because of COVID or because they're not with you at the time of whatever's happening. And then this talks about extreme weather emergencies. In Nebraska, I guess we don't really have like the hurricane situation where you might have to evacuate your house or something like that, but that is kind of what that is talking about. Like if you have something in your area where you have to abandon your house, like wildfires or whatever, that to take that with you. Okay, so 6 steps to optimum care. And this talks about this in the hospital kit. I don't even know how we're doing on time because I can't see my clock. So making sure you're ready. So not only ordering your kit, but making sure you get it filled out. Finding a good hospital. So making sure you know whether or not what your hospitals in your community, what their regulations are, whether your medications are on their formulary. I don't think it's a bad idea to call and ask that, so that you know what to expect when you go. Be vocal. So every time you're asked about the medications, provide a copy of that medication form. If you did take your medications with you, let your nurses and doctors know. And this is something that people don't always think about or know about, but most hospitals have a patient advocate. So that's somebody that you can ask when you're feeling like the nurses or doctors aren't listening to you or you're not getting where you need to. You can ask to speak to a patient advocate, and that person is supposed to, kind of bridge the gap between you and the hospital staff. Get moving. So as soon as you can, indicate that you want to be able to get moving and get some therapy going so that you can get your mobility back. Stay on top of your care. Essential to pay attention to the medications, treatments, and tests. And under COVID right now, I think it's so hard, again, not knowing whether or not your care partner can be there. As care partners, I think, really indicating to the staff that because your loved one has Parkinson's, you want to know these certain things. You want to know what time of day your loved one is getting their medications, and are they getting them on time, and really insisting on a daily phone call. I really got on a not very good list at the hospital in Norfolk. I don't think they looked forward to talking to me. They did not appreciate all my questions, but I honestly, at one point I just said, I know I'm asking you a lot of questions, but this is, it's just not going to change. I'm going to call every shift and I'm going to find out what medications she's had and why she hasn't had them. So, you can be kind, but firm. I was never unkind to the nurses up there, but I was very direct about what I expected to happen and that what information I expected to find out when I called back. So, and I think sometimes that's hard. It's hard to be that direct. So definitely getting backup if you feel like you're not getting anywhere, doing exactly what Patty did, getting in hold of the neurologist and saying, this is what's happening. I need help. Negative things are going on and I don't know what to do. So Patty did the exact right thing. Okay, so wear and care, that's just a picture of it. So this is just other things you can do. So the Parkinson's Foundation has a whole pages on their website about the wear and care program, also updated with COVID information. There is doctor's letters related to both COVID. There are letters on the website where you can advocate that you need to be present because you are a care partner, and there are reasons because your loved one has Parkinson's that you need to be able to be present for appointments. If you happen to have a physician's office that's not letting care partners in yet. So there are some very helpful tools on that website. You also can order your kit on the website. So there's several ways. I don't know if the next slide is about ordering the kit or not. Might not be. So I'll just tell you about that. You can go on Parkinson's Foundation website and order it under resources. You can call me. As an Aware and Care ambassador, I'm able to keep them in stock. So I have, 20 or 30 Aware and Care kits that I'm happy to mail out to you or drop off to you, depending on where you live. So you can just get in contact with me and I will get you a kit. Or like I said, you can order them online. When I order my bulk kits now, they used to take a long time. Now they are, because of COVID, they're really trying to get on top of things. I've been getting them like in 3 or 4 days, like super fast. So if you order one online and for some reason you don't get it quick enough, let me know and I'll bring one to you. But really, they're free. They do. Oh, the other thing that's in the kit is there is an envelope that's asking, if you're able to give a donation for the kit, that you do. But you don't have to. They're free. They send it to you without any payment. We already talked about that. And we already talked about my role as ambassador. So I always try to tell people when I'm doing this presentation, if there's another group that you think would benefit from hearing about it, or if you have an in at a hospital or with any physicians group, please let me know, because the goal is to get the word out as much as possible. I'm the only Aware and Care ambassador in Nebraska that I know of. So, okay, that I think is all I have. So I'm going to stop sharing so I can see you all, because otherwise I can't see very many of you. Yes, Barry. Oh, you're on mute. You're muted.
Question for Patty.
Oh, yeah.
When she was leaving the hospital, can you elect to go to home and hire VNA or somebody to come in as skilled caregivers rather than go to the skilled nursing home, or was it required and mandated you went to that? I mean, did you have options?
I had options. Paul's problem was he was not able to climb the stairs, and
Okay.
we live in a split level.
Mm-hmm.
And so in order to get him home, he needed to know how to climb stairs.
Okay.
So we did have options. Now we have a ramp, and we just got a stair lift added to our house today. So this will never happen again. But yeah, that was definitely an option.
Cheri, the wrist bracelet is very good, but I had a medical person cut it off me.
So you need a new one.
Oh, I got it.
Yeah.
They cut the thing,
They just
but
cut them off.
I grabbed
I
it.
know. I know, that's the problem too, is that's kind of one of the first things they do is take off everything that you have on it. But so if you're alert and can say something, you know, tell them that you need them to know that you have Parkinson's. But yes, that does happen. And certainly in an emergency, sometimes they have to. Some people are wearing or, you know, have different kind of emergencies, like a necklace. So you certainly don't have to use that one by any means. I was even talking to a group not too long ago that there's like one that kind of looks like a Fitbit. It's like, and it's electronic. So it actually can be scanned or something. And then there's a digital, some sort of website or something that it goes to that tells you all your diagnoses or something. So I think it's, I can't remember the name of it, but there's lots of different medical ID bracelets out there. And certainly the one in this kit is not the prettiest. So it's up to you if you want to use that or not. But does anybody have any other questions?
I'm just curious how your aunt came out in the end.
So, you know, she is actually doing much better. She is back at her facility. I just went and saw her last weekend through the window, still through the window. But she's alert. She's talking. She's, I would say, still very weak, but cognitively back intact, can call me on the phone and will answer her phone. So she is doing much better, but it was a very close call. I mean, she really had declined significantly by the time we caught it, because my uncle, who, and this is another example, my uncle is a strong advocate for his wife, and he, as not being able to visit, he was calling every day and saying, is she getting her medications? Is she getting her medications? And the nurses were like, oh yeah, she's getting her medications. But he never thought he had to ask, okay, is she getting every medication that she was on? He just assumed, as anybody would, that she was getting everything that she had been at the facility. So by asking if she was getting her medications, the nurse was saying, yeah, she's getting everything that's ordered, but her Parkinson's medications weren't part of that because she was on Compton and Rytari, and they did not, that was not on their formulary.
And it wasn't on time.
Oh yeah, for sure wasn't on time. So then once we got her on Cinnamon, so finally once we intervened and realized that she wasn't on anything for 10 days because of this formulary issue, got an order for regular Cinnamon. By then she was struggling swallowing. So then she was sleeping through. I mean, she was essentially not awake or alert at that point, not taking any of her medications. Then we had to get the dissolvable. So, I mean, it was just this whole series. And when she pretty much became not alert, is when he called me and said, what should we do? I can't figure out why she's not bouncing back. Like, she went in way better than she is now. And they're saying she doesn't have any respiratory issues, but she's not alert at all. And I was like, well, she's not alert if she's not getting her meds. And he said to me, well, they're telling me she's getting her meds. And I said, okay, well, if you want me to call and just find out what meds she's getting, I will. So I just called. So he called and said they could talk to me. So I called and I was like, okay, can you just go through her med list with me and tell me what meds she's getting? And then there was nothing for Parkinson's. And I was like, oh, that's why. That's what's wrong. So yeah, it was, yeah, scary, very scary.
Amazing.
So anyway.
Anybody have any last minute questions about
I
the
have
aware
a
and
brief
care?
comment on this subject of these little medication bottles. You ought to go through them every once in a while and look, because those labels will have an expiration date for the medication that's supposedly in them, and you of course want to transfer out the medication that's going to expire soon and switch out a bottle that at least has a label that's sometime in the future, so you don't have to get in the hospital and they're looking, oh, this expired.
They're expired. Right. I totally agree with you, Mike. And I meant to mention that's the other thing I would do at the 6 month or the doctor's checkup, whether that's every 6 months or year, is trade out the medications in your bag for new medication. So you keep that rotation going, so you don't have expired
And
meds.
trade the bottles.
Or the, right.
Trade the
Yep.
bottles so that the labels
Right. Yep.
are
Absolutely.
approximately correct.
Yeah, absolutely.
Dr. Body gave me, before COVID, I was flying once in a while, and he would give me some, for in case of emergency, tablets that I could take with me in case I missed a flight or a plane. I might run out of, cartridges. Dr. Body would give me an emergency dose. And then after the emergency dose ages out, like Mike says, then he'll give me another emergency dose. So he's got me covered,
Yeah, that's great.
That's good. That's great about those people.
Yeah, absolutely.
Yeah, we're definitely lucky here in Nebraska with everybody up at UNMC, and
Absolutely.
we really just have a really awesome community, and we're building it up statewide, which is really exciting. Another exciting thing I just want to share, if you didn't see in our last newsletter, starting next month, Parkinson's Nebraska and PDWELL are going to be partnering for these monthly education series, just like we did tonight. So just stay tuned for those, because I think that'll be really, really awesome to be able to kind of combine our resources, and I'm really excited for that. So thanks again, Cheri, for doing that, and then for joining us tonight.
Yes.
Great discussion, everybody. Thank you.
Yes. Thanks, guys.
Thank you very much.
Yeah.
If you didn't have any other questions, I hope you have an awesome night, and we will see you next month.
Hey,
Sounds
Cheri,
great. Yes, Barry.
how's your son?
He's doing good. He's doing good. He's back playing basketball, so he's happy. Yeah, he's doing good. I
Take
miss
care.
you.